The liver disease is a silent disease. Patients have no symptoms at all until it's too late. Anybody who's overweight, anybody who has any family history of high cholesterol, high lipids should be checked out. Those are the risk factors. Anybody who consumes lots of soft drinks, especially the non-diet, they have lots of concentrated fructose syrup. That's been implemented as the #1 cause of the obesity epidemic and the fatty liver. So this accumulation of all those factors is causing fatty liver, and that can cause hepatitis. By definition, hepatitis is inflammation of the liver cells. This is going to become the #1 cause of cirrhosis of the liver 10 years from now. To adjust the therapy, we need to know how bad the disease is, and this is where a FibroScan comes handy. A FibroScan is basically a non-invasive method of finding out how bad the liver disease is. Now, cirrhosis of the liver is irreversible. Once people have this scar tissue, then we lost the opportunity of treating them. It becomes a slowly progressive disease that can lead to death. In the past, to find out how bad the disease is, we used to do a liver biopsy. Liver biopsy, obviously, it's invasive. You have to have a needle, a long needle, you have to have some local anesthetic. There are some risks involved, inherited risk, even though they are rare. This technology will give us very similar results without any needles, without zero risk to the patients. Up to 25% of people in the US have severe acid reflux at least 3 times a year. In those patients, we do a new diagnostic tool called 48-hour pH Bravo esophageal acid test, which is basically a capsule that will measure the acidity of the distal esophagus over 48 hours, transmit the data to a receiver that the patients wear. Having this Bravo testing, they can go home, have regular meals, and will have no discomfort related to the device. For patients with higher risk of developing cancer, we can do endoscopic procedure called HALO, which is radiofrequency ablation of the Barrett's esophagus. After aggressive acid suppression, the mucosa will be replaced by normal appearing mucosa, thus reducing the risk of esophageal cancer significantly. I think Trinity traditionally has been very physician-friendly. Physicians who work here really love the environment. I think the nursing staff is excellent, one of the best hospitals I've worked with. Our nurses really take care of their patients. They are experts, they are really committed to the cause, and they're very passionate. So this really makes a big difference. And also we have our Endoscopy Center, which is ambulatory. It's like standalone outside the hospital. That brings more relief, the anxiety, that relieves the anxiety for patients coming through. It's very efficient. Our patients are in and out within an hour and a half to 2 hours in a very friendly environment. So this really what brought me here, what keeps me in Steubenville and Trinity.